own colleagues at the University of Birmingham recently completed research looking at how PCTs are doing priority setting. Can you tell us what the main findings were from that research?
The main findings were that PCTs are doing lots of exciting, interesting work around priority setting, but this tends to be quite marginal around new technologies or new developments rather than around core spend, and looking at very much around the technical processes. And what we did find was that they struggle to sort of really look at core spend, look at budgets, and to really get into the nitty-gritty of priority setting and rationing. But there are, having said that, there are some very good tools and techniques and processes out there that can be applied, but they're just within sort of one area of priority setting rather than across the whole core spend.
And in terms of examples where people have looked across the core spend, can you give us an idea of how that was done?
Yes, we had a couple of case study sites that we went into, and we targeted them because they'd looked around core spend. And one of the key things that came through was around how you engage with the various stakeholder groups from across the health economy, and where PCTs and commissioners were engaging, they were making more headway in terms of priority setting. It's difficult in terms of implementing decisions, but they were very much making decisions around what they wanted to spend their money on, around what should we put money into this service or into another service.
So for GP commissioners just starting out in their commissioning role, how would you say they should start going forwards in terms of priority setting?
It's very important, I think, that there's a will to do this and to take it seriously, and rather than it be something that just happens at the margins or happens in a back room, it's very much at the forefront of commissioning, having an idea of what the need of the population is, and then taking a health economy approach to how we might set priorities. So rather than just one consortia, potentially GP consortia, decide on priorities, maybe collectively across the health economy, working with colleagues from local authority and from provider arms, as well as GP providers and acute providers, and thinking, how are we going to make changes, how are we going to reduce investment as well as invest in services.
And certainly one of the things that came out from your research was that PCTs wanted to involve more stakeholders and the public. How can they do that? How can GP commissioners do that as they move forwards?
I think some of that's around going back to some of the techniques, the tools and processes that are available. So for example, multi-criteria decision analysis, the accountability for reasonableness framework. So there's different processes out there, or techniques and tools, economic tools, that can be very helpful in thinking around how we might bring colleagues together. So programme budgeting, it uses evidence base, so it talks often to clinicians, so we can bring people together using various processes that are already tested by PCTs, and we can use that to bring people together to really engage with both clinicians, managers and the public.
What do you think could be done at a national level to support GP commissioners as they take on their priority setting role?
I mean, a helpful thing, but maybe it won't happen, would be for the government to have a dialogue with the public about what should and should not be funded by the NHS. If we have got limited resources, then having that dialogue and saying we can't provide everything with this limited pot of money would be helpful for people locally, because it would mean that that message was not just a local message, difficult local message, but actually happening nationally. And I think also the government could set policies that might incentivise people to change behaviour. So for example, within the study it found that payment by results maybe wasn't that helpful in some respects, because actually it focused on incentives around productivity, which sometimes could be difficult. So it's trying to think what policies the government could develop that could incentivise behaviour around rationing and scarce resource.